On today's Health Watch, we bring you to Aesthetic Laser and Vein Center in Santa Rosa. We have Dr. Walter Tom with us today. Thank you for joining us, Dr. Tom.
Thank you, Melinda.
I understand you're doing a lot of exciting, new, advanced procedures here, and I heard about the HCG Zerona Diet. I have to know more.
It's fantastic. We're so excited about this. This is a combination of homeopathy meets Western medicine science. It's so exciting.
And you lose inches.
You lose inches and you lose pounds, and this really works. Our Zerona is this low-level laser. You don't feel anything at all. You lay under the laser and it makes our fat cells become leaky. And before you know it, the fat starts leaking out of our fat cells within about 18 minutes. It gets excreted through our liver and our kidneys, and we begin to lose inches as well as weight. What's so great about HCG is that it allows us to immediately access our fat cells. So when we are on a low-calorie diet, we actually begin to lose fat immediately.
But if you're only eating 500 calories a day, wouldn't someone lose weight anyhow?
Yes, they absolutely would, but think about how hard it is to be on 500 calories. I certainly couldn't, but with HCG, we're able to tolerate this very low-calorie diet, and therefore, we lose weight.
Diet like this, Dr. Tom, who's the perfect candidate?
Well, I think the perfect candidate is somebody who kind of grabs their abdomen and they have a couple of inches there. And if you've got a couple of inches there, you'd be a great candidate for our Zerona HCG diet.
Okay, well, I didn't want to tell, but I have to tell. I tried this diet myself. When you said a couple of inches, I have to confess. But it works. And I was concerned because I thought I've never been on a 500-calorie diet, and I'm a very busy and active mom. But what you said about not getting dizzy, not feeling lightheaded, it actually works, and I thank you for that.
You're most welcome, and that's really the key. Zerona helps to make our fat cells leaky, so it targets our fat cells. And HCG, when we go on these low-calorie diets, allows us to start losing fat immediately. The difficulty, as you said, is being on a 500-calorie diet is that we get so lightheaded, we feel tired, we start to have muscle aches, and HCG helps to minimize those symptoms, so it makes it so much more tolerable to be on a low-calorie diet. What HCG does is allow us to go to those trapped fat stores. We all know where those are, our little muffin tops, maybe around the hips, in your abdomen. You've worked harder and harder and harder to try to get rid of it and you can't get rid of it. HCG, along with Zerona, helps us to target those areas specifically. What we're finding is that patients are losing 5 to 9 pounds in the first week. They're losing multiple inches from their abdomen, their thighs, their arms, their chest area. And what's really exciting is that after a 3 or a 6 week course, when they're just on sort of the recovery diet portion, they're still losing weight. That's what's so exciting. That's that we're hoping for our patients to establish a long-term weight loss program.
We thank you for joining us today, Dr. Tom. Dr. Walter Tom is located in Santa Rosa and Napa. It's not just for Hollywood, it's here in the North Bay. On your Health Watch, I'm Melinda Meza.